Hi, my name is Cathy Patterson-Sterling, and I'm the Director of Clinical and Family Services for the Sunshine Coast Health Center. And we're going to do a 6-part series kind of answering the question of boundaries. When I do family program, boundaries is really one of those questions that people talk about a lot, and we often have a lot of conversations about boundaries. And so we reserve a huge section of family program to discuss exactly what boundaries are. Boundaries is this term that we kind of pass around in the field of psychology, like as if everybody knows what boundaries are. And so what I want to do over this next 6 weeks is kind of answer questions about boundaries that I've had over the past number of years, and looking at how to break boundaries down as a topic. So boundaries is this sense of where I begin and end and where you begin and end. And it comes out of family systems language around enmeshment. And there's this idea in enmeshment that we are kind of merged together, or that there is no sense that you are kind of an extension of who I am. So there's me in the world and you're an extension of my needs and feelings. And boundaries is that absolute clarity around where I begin and end, you begin and end. And with that clarity around where each of us kind of are in our own personal space and emotionally in our space, then we have the ability to then get clear about what are my issues to own, what are your issues to own, and what are our issues together. So really important work needs to be done around kind of getting clear about where I begin and end and other people begin and end. Otherwise, I start attaching myself to other people's thinking and to their experience, and we're kind of like Siamese emotional twins walking through life together. And so I go down in other people's issues when they're having problems, and vice versa, and we don't achieve that peace. So we're working on kind of finding that solid sense of self inside of ourselves around where we begin and end and others begin and end. I look forward to talking to you next week some more about boundaries. Thanks so much. Take care.